Care. Dr. Molefi, thank you so much for making the time to talk to us this morning. The lockdown has resulted in confusion about where citizens can go for testing, but healthcare clinics and hospitals are essential services and continue to be open for HIV tests, ARV refills and other important health services under any lockdown level. But are people getting tested?
Okay, good morning and thank you. Well, as you've said, healthcare is an essential service. So basically all healthcare services have been open and available. The problem is that some people have been confused and some have had we have had anecdotes of some unfortunate experiences that have made people sort of step back and shy away from going to the health facilities. But it is important for people to note, as you've said, that actually health facilities are open and available for people to get any healthcare service. So testing for HIV is one of the health services that is available for people. But remember also that there used to be an opportunity for people to test also at community level, be it at their homes or at specific places where HIV testing campaigns would be held. So at the initial stages of the COVID response, the community opportunities were sort of closed as we were trying to figure out how to best respond to the COVID response. And I think now it is becoming clearer that we are able to overlay some of these services also in the community, but they are quite they're quite specific, and people would need to find out which area has the services for them to access them. But the important thing is that the services are available, particularly those that are at healthcare facilities still available for you at the clinics, at the CHCs, community healthcare centers, as well as at the hospitals. So the problem would have been people being not sure or misinformed as to whether these services are available or not, but we can assure them that they are indeed.
Yeah. The conversation about HIV treatment has really taken the back burner during these times. Are there any new innovative protocols in terms of how to access ARVs that have come up in recent times that we haven't spoken about?
Oh, most definitely. I think the biggest deal is also to say some of these are not new. We are just upscaling them and, using them more to assist us in the COVID response. I'll give an example. The new adherence guidelines that have been updated by government are actually an update of an existing guideline. So for the past few years, people have been able to access their medication outside facilities. So they should have been stable patients who had no issues, would need to go to facilities or simply to collect their treatment. Now, what would happen is that they would be able to access the medication outside a facility. They'd go and pick it up at a certain pickup point. There were many pickup points. It could include private facilities, private GPs, private nurse practitioners. It would include pharmacies, post offices, a lot of areas where people could access medication easily. Now, what was also brought on were PDUs, which are pharmacy dispensing units that look like ATMs. And now recently we've also rolled out e-lockers. So these are rolled out by NGOs that are supporting government, and one of the Right to Care subsidiaries, Right e-Pharmacy, is also rolling out these. So these lockers are the same as the lockers where you collect a parcel at a garage or a service station. So you are able to then go at a particular time because you would have had a PIN that tells you that your medication is ready. You go there, you punch in your PIN like you would for any other parcel, you're able to open the locker and get your medication. So you can sort of control the time that you go to the facility and even the time that you spend there, so that you obviously adhere to the protocols in terms of COVID. That would be social distancing and minimizing your contact with other people. So those are in place. They've been in place for a while, but now we are really ramping them up, rolling them out in more facilities so that we can give access to more people.
At the initial announcement of COVID-19 having arrived in South Africa, Right to Care sent out a statement warning patients with HIV that they could be part of that group of people who are more exposed. Are you happy with the COVID-19 protocols? Do they protect HIV-infected people as well from infection and from further exposure?
Okay, so I think the important statement to make here is that we are saying if you are immunocompromised for whatever reason, and now we're speaking specifically to HIV, you stand a higher risk of negative outcomes should you be infected. So this means that you probably have more severe disease, and also the complications of COVID would be more with people who are immunocompromised. So it's important that whoever is immunocompromised, particularly who has HIV, you know your status so that you can get treatment. If you're already on treatment, stay on treatment. And should you have stopped taking treatment, please go back to treatment so that you make sure that your immune system is strong enough to withstand infection and can fight against COVID infection. So I think what is important is that people need to internalize this message. In terms of the protectiveness of the current COVID protocols, yes, they protect. They protect actually everybody. So they protect everybody, including those who are immunocompromised. But it's important for people who know that they are at higher risk, that they sort of are more stringent in their application of the guidelines. You really, really shouldn't be going out if you don't have to. Hence, we are saying that we understand people need to go and take medication. Now, what areas should you be going to so that your exposure is still limited? You're still going to access this essential service, but we are saying let's limit your exposure to possibly infection. And so you still apply all the protocols. You still make sure that when you do go to the e-lockers or to your PDUs or even to your facility, you still make sure that you are wearing your mask. You still apply social distancing, and you sanitize, and obviously wash your hands regularly when you have access to water and soap.
Is Right to Care happy with the health department in terms of their systems for ensuring that medication and treatment gets to the people who need it?
We are very happy in terms of the fact that treatment is accessible. And as I say, all these measures that I have just talked to, they are actually being rolled out by the Department of Health, so by government. What we do as an organization is to support them. We support them with various means, bring the innovations, government takes them up, have people that will assist the rollout, and also support the systems that makes these efficient systems able to run. But the fact of the matter is that they are within the government framework. So in terms of access, in terms of ensuring that there's availability, I think the government has done pretty well. We understand that there are a lot of constraints. Obviously, things like where do you source medication? If it means it needs to be imported and all that, obviously, all what is happening globally is going to impact our services. But I think a lot of work has been done, and the results are such that to a large degree, our patients are able to access services and their medication as well. So we're quite happy. There's always going to be room for improvement, and our continuous discussions and interactions are helping this happen. So the important thing is also to keep the public informed so that they are able then to use these opportunities that are being availed to them.
So the big conversation now is looking ahead to that anticipated announcement by the state president of a move from alert level 4 to level 3. What kind of conversations is Right to Care having about this eventuality?
So the kind of conversations we are having would actually be cross-cutting, and we are also looking throughout the timelines. The important thing is that people need to understand, just because the levels are being changed, it doesn't change the fact that there's COVID and there's a risk for COVID infection and poor outcomes. So when the level changed from 5 to 4 and then from 4 to 3, if it does change to 4 to 3 and when, it won't change the fact that we still need to ensure that the triad of protection is implemented. People still need to make sure that they protect themselves, they use masks, they apply social distancing, they sanitize and or wash their hands when they have access to water and soap. So the conversations are that we need to continue. Don't relax. Just because we're saying we're at a lower level, it doesn't mean that you now need to relax and think that, oh, it's all good and I have no more risks. So we need to ensure that people understand the continued risk. They understand what is new in terms of if there are any new developments, because remember, COVID has been an evolving disease. So we make sure that people are informed of any of evolution in terms of information for them and for their healthcare and what it means. But we are also continuing to make the message clear that healthcare services are open and available for people to use and access to manage their health.
Dr. Seithati Molefi, let's thank you so much for your time this morning. Dr. Molefi is the Chief of Healthcare at NPO Right to Care.
Thank you.
Let's take a break. We'll be back in a moment. You're watching The Agenda.